Hi, Yoshi and Monica here. In this episode, we talk about the anatomy and function of the upper arm muscles which are in charge of elbow flexion. And along the way, we give you a few tips and exercises for your next arm workout. So let's dive right into it.
When we're talking about a bicep curl or an elbow flexion, we usually talk about three muscles. And the first one that comes to everybody's mind is the biceps brachii, or generally called the biceps. Bicep means two-headed and brachii means of the arm. The other two muscles involved in elbow flexion are the brachialis, a smaller muscle located underneath the biceps, and the brachioradialis, a long muscle in the forearm that also assists in elbow flexion. The biceps brachii is a biarticular muscle because it runs over two joints, the shoulder joint and the elbow joint, and it doesn't have any attachment on the humerus or upper arm bone at all. The biceps has two heads, a long head and a short head. The origin of the short head is on the coracoid process, the top and front end of the scapula, and just on the side. Even though the muscle is known for having two heads, it is one of the most variable muscles in the body. So it is pretty common to find a third head, or in some cases even more heads, attached next to the short head on the bone. The long head originates at the supraglenoid tubercle, a bump on the top or the superior aspect of the glenoid fossa, which is the part of the shoulder blade that connects with the upper arm bone to form the shoulder joint. The tendon runs over the humeral head and in the bicipital groove, and along the way fuses with the short head to form the muscle belly. Together, they are attached to a joint tendon into the radial tuberosity, a small bump on the top and medial part of the radius bone. Another portion of the tendon inserts into the bicipital aponeurosis, a flat sheet of tendon-like tissue that expands out into the forearm and attaches into the deep fascia to protect the muscles and the main artery and nerve. The muscle deep to the biceps brachii is the brachialis. The origin is the distal two-thirds of the humerus. It runs down, crosses the elbow joint, and inserts into the ulnar tuberosity and the coronoid process. So, because of the attachments, the brachialis is doing a lot of work and is pretty much active at all times. This makes the muscle to a strong and effective flexor for the forearm. The brachioradialis, the third muscle we are talking about, is another superficial muscle like the biceps brachii. The origin is the distal portion of the humerus. From here, it crosses the elbow joint, and because it's quite a long muscle, it runs all the way to the distal part of the radius. Let's talk about the actions and which muscles are activated in a supine, neutral, and pronated position when doing a bicep curl. Starting concentrically in a supinated position, that means when the insides of the hands are facing upwards, all three muscles, the biceps brachii, the brachialis, and the brachioradialis, work together. And they reach their strongest point when they're at an angle of around 55 to 60 degrees. Now from here, when we're moving the forearm closer towards the shoulder, the brachioradialis has to work harder and is more involved. Now, what's interesting is when we're moving eccentrically, that means lengthening of the muscles, the biceps brachii takes on more of the workload. That's one of the reasons why fitness pros like to bring the focus more towards the eccentric portion of a bicep curl rather than the usual concentric phase. In a neutral position where the thumbs point upwards like in a hammer curl, all three muscles are activated pretty much the same way, so they can work together and create a powerful movement. Now, in a pronated position where the insides of the hands are facing downwards, the brachioradialis has to work harder, and this has to do with the insertions of the biceps brachii. Remember, we talked about the insertions on the medial point of the radius and the aponeurosis. So when we rotate a forearm into a pronated position and with that cross the radius over the ulna, we bring the biceps brachii into a weaker position to get maximally activated for a curl. Why? Because the biceps, which is also a strong supinator, first wants to turn the forearm back into its neutral position. And you can experience this bicep activation, for example, when you screw a screw into the wall. With that said, the brachioradialis takes on more of the workload, at least in the beginning, up to the point of around 120 degrees. Then the bicep gets proportionally stronger again. Another example is when we're doing an overhand pull-up. Of course, the lats are the muscles of power, but you also need to flex your elbows. Here, the biceps is not a lot of use compared to the brachioradialis, which again helps with the flexion of the elbow joint. But when you turn your hands into a supinated position for an underhanded pull-up and the radius and the ulna are aligned, you get your biceps to work at full capacity.
In fitness, we have lots of options to activate the upper arm muscles for an elbow flexion. You can use free weights, cables, bands, barbells, and machines. Now, if we're talking about yoga and a biceps activation, it's a completely different story. Unfortunately, there's no specific pose that works your biceps. Sure, if you Google it, you will find lots of articles that want to make you believe that there are particular poses, like for example chaturanga, down dog, or side plank, that are made to work your biceps. But that's simply not correct. We all know yoga is a great arm workout for the triceps and the shoulders. But if you want to balance that out and include the biceps, you have to supplement yoga with some fitness elements. With that in mind, check out the upper arm exercises we filmed for you to get you started and pick the ones you like.